our current clients, bring your friends, because we are also offering specials for our current clients. Um, we talked about, so once again, September is Sexual Health Awareness Month. And your sexual well being is an important part of your total health. So we wanted to make sure we were addressing all of this fully. So today we are talking about, because we've gotten a lot of questions about this. So what's the O shot? What's the P shot? What's the G shot? All these letters, what are these shots and what do they do? So we are going to talk a little bit about that today, and then also some other options that people can have to also help with their sexual well-being. So let's get started with that. We do love when you join us. So like us, subscribe to our YouTube channel. We have our podcast. So stay in touch with us because we have lots of information that is coming out, and we want to make sure that you are fully educated and you know exactly what you're getting and why you're getting it. So let's get started. So what's the O shot? Um, First, let's start with what is PRP. So PRP is the basis for all of this, and all that stands for is called platelet rich plasma. So it is your own blood. We draw your blood. I even brought the centrifuge so you can actually see what we do. So we draw your blood. When we draw your blood, we put your blood in one of these tubes. And in these tubes, they have a separator. So what we are trying to gather is we are trying to separate your plasma, which is the clear part, and there's a thin layer of platelets that sit right above this layer, this little thick gel area. Those are the platelets. And then once we spin this down, your red blood cells, it's what's in that's collected at the bottom. We don't really, so people talk about the vampire facial. That also uses platelet rich plasma, or PRP, which is what I'm going to say from now on. It's PRP. It uses that as well. What your plasma has in it, especially the platelets, is they actually activate stem cells. And stem cells are rejuvenating factors. So we use PRP everywhere. It started in wound healing. It was in ortho because they were treating people with injections in the knees and in the joints to help replenish and repair those damaged areas. They were even doing it in dentistry. But people started to understand all the rejuvenating factors that the platelet rich plasma has. So we started using it in aesthetics. We started using it in sexual health. So one of the biggest things that it will do is it will improve collagen production. It increases vascularity. It helps with repairing any areas that are damaged. So there's a lot of things that your particular plasma, especially those who don't want anything foreign in their body, you can use your plasma to repair damaged areas. We use it for acne. We use it for anti-aging. And now we use it, well, we inject it in the vagina, we inject it in the penis, and it actually helps with sexual health and awareness. So, O shot. What the O shot is it is taking your plasma. So after we do this whole procedure, and we do this in front of you, so we don't take your blood, go in the back and get something else. We are actually using your plasma. So we take your plasma, and we do have laughing gas here. So for those who are like, you're going to be sticking the needle where, we do a lot of things because I don't like pain. So we do a lot of things to reduce any discomfort that you may experience. So we have you come in. We actually put numbing cream in the areas that we are going to inject, and we let that sit for a while. And if you choose to, we do have laughing gas that you can also use. It wears off in about 10 minutes after you're done with the procedure. So that is an option that is available to those who, like myself, don't really like needles and freaks you out a little bit. So we do have that available. It's not something that's excruciating or significantly painful, but we have it there. So, how this process works is we inject around the clitoris, we inject in the top part of the vagina because it is going to help rejuvenate those areas. So people who have clitoral orgasms, injecting that plasma and platelets around that area will help stimulate more orgasms for you, even in the vagina. So because we are injecting on the top part of the vagina, the bladder sits right above that. So it is also shown to improve urinary incontinence. So if you are leaking urine or you're having urgency, it actually helps to stimulate that because it affects the so it'll help with people who have vaginal dryness because it's actually going to improve the blood vessels that supplies the vagina. So the moisture is better. It increases the orgasms. It helps with urinary incontinence because once again the bladder sits right above there, so it affects the nerve function. So there's lots of different benefits that you can do from the O shot. It's not just the orgasms. It does have some other benefits as well, but the orgasms are a significant plus. Now, what's the P shot? Does the same thing as it will do as an O shot. So it's going to help increase the erections. It's actually going to help increase the sensitivity for those who have more of a curved penis. And for some people, because the curve is so severe, it can cause pain for some of those people. It actually helps improve that. People who have pain when they have erections, it'll help improve that. It definitely improves the sensitivity. It can improve the girth and the length. Now, it is not going to take you from 4 inches to 12. It's not going to do that. But it does improve, once again, because it builds collagen. It is going to improve some size in the penis. So that's the P shot. That's the biggest difference. Is one is for the vagina, one is for the penis. Now we say O shot, P shot. Those are terms that were coined by another physician. So generally, it is basically taking your plasma and injecting the vagina and the clitoris for women and injecting the penis for men. Now, there's another letter that we have to deal with. What's the G shot? So, what the G shot does is there is an area in a female where it has many more nerve sensations and a fiber. So it's called the erotic zone. And when we inject that, a filler, so a filler is going to actually add volume. It is going to cause super heightened stimulation because now you have a bulge in that particular area where we inject the filler. So when you're having intercourse, you're constantly rubbing against that bulge and it increases the sensation significantly. So that's what a G shot is. So a G shot is actually using a filler. People ask, how long will it last? Especially when you're using a filler. The fillers will vary because it depends on the filler you choose. There are some fillers that last for 6 months. There are some fillers that last for a year to 2 years. It depends on the filler that you're using that will determine how long you actually, for the G shot, how long it will actually work. For the O shot, generally it's anywhere from, people say 12 months to 18 months, but it's usually more like 6 months to 12 months. And once again, it is not something that you need to take off work. You could do it the same day. We do tell people no intercourse the day that you actually have the procedure done, but the next day is fine. The other thing I tell males, so when you are doing the P shot, they do recommend using, it's a vacuum assisted device that actually helps to stimulate, and that's more so that the plasma with platelets actually are being diffused through the entire penis. So that, and it actually shows an improvement in your results when you actually use that vacuum assisted device. So now we've talked about the injections. What other things could we do to actually improve vaginal rejuvenation? even erectile dysfunction. So, because I'm a gynecologist, I know all about the vaginal rejuvenation, but I'm going to read you the list of for erectile dysfunction of all the options because there are a lot of different options. For women, there are probably 7 different companies that have vaginal rejuvenation devices, and they range from radio frequency to lasers. And the length of how long it takes to do the procedure will depend on the device. I brought some of the devices that I use. So I have the UltraFem and I have a Thermiva. So, and they're both radio frequency. I started off with Thermiva. So this is like an example of the probe that we use for Thermiva. So I use this one in particular for my patients who have severe vaginal dryness and pain, especially if they're older and the vagina has not shrunken, but becomes smaller, and so it's more difficult for them to tolerate anything going into the vagina. So I use this. I use this because this has a smaller footprint. This is the area that has the radio frequency, and I can actually treat the entire vagina by doing it in different segments, but it is causing the tissue in the vagina to actually, just same as the plasma, rebuild collagen, increase vascularity, increase nerve sensation. Same as the plasma, these devices can also help the bladder because it sits right above the vagina. So when you're doing radio frequency, even the laser, it is helping to repair the tissue. It is helping to increase the vascularity, so the lubrication. It is helping to increase the sensation. This is the other one that I use, and I have 2 different sizes. This is the smaller size, for once again, for people who have a more tighter vagina where it's uncomfortable. This gives you 360 degrees of radio frequency. So I don't know if you can see the silver area. That's where the radio frequency part is coming out. This is a little bigger, so it'll cover more area, but these work great. To treat inside, it takes 8 minutes for these 2 devices. This is the one that I use for outside. So I do each of the sections. So I do each side of the vagina, I do the clitoris, I do the opening to the vagina. It will help with tightening, but not just tightening. It improves the elasticity. So it's not uncomfortable for you when you're having intercourse. The dryness starts to improve. But this will also externally make the tissue actually become tighter because it's going to, once again, help rebuild collagen. So when you know that the tissue is starting to be a little thinner, which is what happens when you lose your hormones, when the hormones start to decrease, it affects everything. It affects the skin, the vagina, it affects the hair, it affects your weight. So lots of different things that happen when your hormones change. So this is something that we can do mechanically to actually help improve the vagina and the bladder. For men, erectile dysfunction, there's lots of things that they have available for men. So there is Viagra, and these are pills. So there's Viagra, there's Cialis. Those are pills that you can actually take that actually will help with erectile dysfunction. They're called extracorporeal shock waves. So all it does is it's a device that you actually, and there's no injections, there's no needles. Alma has a device called Duo, D-U-O, for those who are interested in it, where it takes probably 5-10 minutes to do the procedure, but there are no needles, there's no pain, there's no discomfort in it at all. But you are actually, those shock waves are actually stimulating growth of the vascularity, of the nerve sensation, and you're actually just pulsing along the penis and around where the growing is. So it helps with that. There is surgery, which is, I tell people, surgery should be a last resort option, but there's a possibility of doing this surgery. There are certain injections that people can do other than the plasma that will also help. So there's lots of different options that people have. You just have to talk to your doctor about it, and you have to ask. Um, a lot of people, and a lot of physicians as well, we don't include sexual health as part of your visit unless you're complaining about it. So I'm a little different just because I am a gynecologist. I want to make sure that for my patients, sexual health is also something that we discuss because it doesn't end at 50. It doesn't end when you go into menopause. It continues on. And they've actually done lots of studies that people who are more sexually active have a better sense of well-being. So we want you to have a total sense of health, of wellness, of total well-being. So once again, sex doesn't stop when you turn 50, when you turn 40, when you turn 70, when you turn 90. It doesn't have to stop. As people are probably looking like, who's doing that at 90? You'd be surprised. I have lots of patients who are still engaging, and it's healthy for you. There's no taboo about this, but it is something that if you have questions about it, you have to ask. You got to get your questions answered. So, that's my talk on sexual health. Hopefully, that kind of helps, and we'll kind of see if anyone has any questions for me regarding any of the topics we just talked about.
There were two topics. There was a statement on Instagram. Given some of these procedures also help other areas such as the bladder, does it increase the chance of insurance paying for it?
Not at this point. The reason is because the devices are listed as vaginal rejuvenation, or for men, I'm not 100% sure. I don't think so. Because it's dealing more. They may because they pay for medication, but I'm not sure for men. But for women, we have a hard time trying to get insurance to pay for basic things. So that's a little harder struggle. But the devices are listed as vaginal rejuvenation, so they consider that cosmetic. Even though you get a benefit of actually treating the bladder as well. I have given people, I mean, I give receipts with the codes on there, and so you could try it and see if your insurance will reimburse you. But as far as I have seen so far, it has not. Good question.
There's one on Facebook. I'm currently taking the hormone pellets.
Uh huh.
My libido has increased. Should I get the G shot instead of the BHRT if my concern was low libido?
So the G shot doesn't change libido. What it does is it changes orgasms and how you feel during intercourse. It may now, if the reason you stopped having intercourse or you didn't have a good libido was because intercourse was difficult or painful, then that might be a better option for you. But the G shot is strictly going to is going to add volume to that area. So when you have intercourse, your partner is going to be entering and actually rubbing against that now increased bulge, which is going to cause pressure around your nerves, around your vascular area. So it's going to increase the sensation. But it doesn't necessarily change your sexual drive or urge. That's more of a hormonal factor. And I have people who do both because they want to increase the pleasures during intercourse. But if they don't really have a desire to have intercourse, then I don't know how much the vaginal rejuvenation or the shots are going to help. Hopefully that was helpful. But if people are interested in having more discussions just about sexual health, we're doing an event on September 28th for the bioidentical hormones and the pellets. We can also kind of set up something where we are talking more in depth about sexual health, and I even have a psychologist that actually has a focus in sexual health. So if that's something that you all are interested in, let us know. We can probably put on an event for that um, just to give you more information. Any more questions? Okay, wonderful. So, um, as I mentioned earlier last week, we're going to start alternating the Let's Talk About Health and the Talk with Terry Tuesday. So we'll do one or the other each month. So we'll start that process next month. We'll still bring on all the Tuesday podcasts that we do with the text, with knowing what the specials are, with just information about the spa and giving you more knowledge because that is our purpose. So thank you once again for joining us with our Talk with Terry Tuesday. I forget which day it was. And we will see you the second Tuesday of every month at 1 o'clock. Okay? Thanks for joining us at Allure Laser and Med Spa in Tinley Park. Call us 708 864 4988. Talk to you soon. Bye.